And my name is Thelma Illems. I say good morning and welcome to the show.
My name is Okiki Oluwakindele. Welcome to the show. Good morning.
And we have our consultant pediatrician in the house. That almost made my heart explode this morning. I mean, Valentine's is a time where people's hearts, they get exploded, but in a very sweet, swift, delicious kind of way. Actually, Dr. Rena wanted to give his enemy a heart attack.
You're supposed to know now.
He's supposed
That's if you get that attack, I will resuscitate you, being a doctor and everything. I'm going to now to resuscitate adults, so don't want to have any attack.
Don't forget baby whisperer.
Yes, the baby.
Speaking of which, can you tell your constituents
Yes.
that Sunday is a very important day?
Oh.
And they should behave themselves. I'm speaking for all the parents out there.
See, I'm going to open.
For a bit, I didn't get what you were saying.
Yes.
But yeah.
I'm going to open a temporary creche for that Sunday. If you need your children to be taken care of, so that people can go and do things that will bring you other children, just come and put them in my house.
Your house.
Yes, we'll take care of them.
I think you should consider that as a line of business, and then perhaps we might not just be featuring you on your baby and you on Naija right. Business.
Hey.
And then you now say the story began
in
Inspiration FM.
Fresh business is not fresh business no easy. Hey.
No, but it's Yamaya.
Unless you're doing fresh business. Sorry, ma, is this your baby? No.
So you didn't bring in. You don't.
It's good to have you, Dr. Ayo Rena.
Thank you. Hey, Instagram Live. Hi.
Yeah. Okay, so once again, you have your shirt on. Amazing. It's pretty. It doesn't have the whole Valentine funny thing that you wrote the last time. But anyway, what are we talking about today?
Today, we are discussing something we call convulsions.
Convulsions.
In children, yes. Convulsions in children.
As much as that just really breaks my heart, it's something that I'd really like to hear what it actually is. Because when you think of convulsion, I think most of the thing that comes from people's mind is how you find children jerking, you find children releasing some sort of substance from your mouth. People say with their eyes go up, with their eyes go sideways, and I don't think I've ever seen. I don't think I've ever beheld one before, but it's amazing how you haven't, but you really hear lots of stories. But let's really know what it is.
Okay, so essentially what happens is that, let me just picture you this scenario. Everybody just picture it in the center of your mind. That, middle of the day, a child sitting down in the house, everything seems fine. Suddenly they notice that the child has a little bit of a fever and they're not sure, like, okay, they use the back of their hand to check, say, this child body is hot. And then next thing, the child just starts to fall down slowly, and then the limbs begin to shake, then the legs begin to shake, the whole body begins to shake, then the child just turns up the eye, and then, it's save me, and then next thing people look for things to put into the child's mouth and everything. So that essentially is what a convulsion, the typical scenario. And usually if you see anybody rushing into the emergency room and they are shouting Egbami, you can be sure that 3/4 of the time the child is having a convulsion. So a convulsion essentially is a phenomenon in which a child has manifestations as a result of an uncoordinated firing of signals from the brain. Now, our body is like one big battery of electricity, So essentially what moves signals, what moves impulses from the brain to the rest of our body to give it instructions to move, to breathe, all that are essentially electrical signals that are channeled by certain fine chemical processes. Now sometimes these electrical signals become a wire. I'm trying to be patriotic. I was going to mention a certain power supply in my area, but we understand what I'm saying. It becomes chaotic, and so what then happens is that the manifestation of that is a generalized. When I say generalized, it means it's all over the body. The body becomes stiff, or they begin to jerk uncontrollably, because the brain actually controls muscle movements, and so when that signal fires abnormally, it will lead to those jerky movements. And sometimes it's not always a jerky movement. Sometimes it's just a stretching or stiffness of the body. And sometimes it's just that the person just starts to stare blankly. So please don't blame people sometimes when they are staring at you blankly and they're not hearing what you're saying. Sometimes they might be having convulsion.
But what do you mean staring blankly? Like they're just... Like they're in a trance?
Yes, like they're in a trance. You tap them, you call their names, and they don't respond to you. And then next thing...
What's happening at that point? Because for many people... when, like Thelma mentioned, when they say a child is having convulsion, the most common symptom or how it shows is the jerking. So
Yes.
the child is just sitting down, staring blankly into space. How does that?
So
where is the convulsion happening?
Okay, so generally, so that's even though I'm trying to focus on the convulsion that involves the generalized shaking, I just want people to know that a convulsion can be without generalized shaking. Sometimes a convulsion will be just that the person is staring like that, and no matter what are you concentrating on, what are you staring at, that yeah. So if a person is staring blankly and you try to rouse the person and get the person's attention, and the person is not paying attention to you, it's either of two things. The person really is not interested in hearing anything that you have to say, or the person is having a convulsion. And usually, if you persist in disturbing somebody, the person will answer you. So usually, the person will just have a blank stare for like 15 seconds, and that's called an absence seizure. It's a kind of convulsion, but it doesn't involve the generalized jerking, you know. So people use the word interchangeably. So it can either be a convulsion, can be called a convulsion or a seizure. What's convulsion? Does anybody know what? I mean, convulsion in Yoruba is giri. I'm not sure what it is in Hausa and Igbo. I'm not sure what it is. Sometimes it's good to just know these local parlance for these
I'm
things.
asking if you know now.
I've not finished learning what it is
In English.
so I don't know
Yes,
what
okay.
it is.
So that's essentially what a convulsion is.
Okay, so who can suffer
Hmm.
convulsion? How young or how old?
Everybody from day zero. The fact that you have entered the world today does not mean that you cannot have a convulsion. Convulsion is no respecter of persons. So essentially, a convulsion really is a convulsion really is a phenomenon that is not limited to any particular age group. So I've seen neonates have convulsion. It's just as let me not say fortunately. It's just that usually if a neonate is going to have a neonate is a newborn within the first 28 days of life. If a newborn is going to have a convulsion on the first day of life, usually to be in the hospital. But it takes skill. It takes a huge amount of skill. It is because I have seen how newborns behave over and over and over again that I know that if I see a particular newborn having a convulsion, I can tell that this newborn, the village people are calling him, they will just be staring. Sometimes they will start smacking their lips. Sometimes they will stretch. So you really have to have a very, very keen eye to know that a newborn is having a convulsion. However, when they get past the newborn period and they become like infants, then the seizures or the convulsions become a bit more typical, such that they stretch or they jerk, they lose consciousness after the event has happened, and then as they get older, sometimes they will pee or they will poo on their bodies, and then they will have what we call a post-ictal sleep. That just means that after the convulsion, they will just become not really unconscious, but they will sleep off, and sometimes that sleep can last up to 30 minutes, and so, no age group is spared. So think about any age group and you can be sure that they can have a convulsion.
But is there any one way to actually identify, because it breaks my heart to actually know that a newborn can actually suffer convulsion, or a baby, below 1 year. I mean, 1, 2, 3 years is actually too young. But I mean, babies below a year can actually suffer convulsion. What should I really be looking out for? What do you see in the eyes or the face of a newborn to know that the baby something's not right?
Yeah, so usually what will happen is that babies are very nice and pink, usually. Even if they are black babies like I was, you will still see that the hands will still be pink, the feet will still be pink. And babies are almost, unless they are very deeply asleep, babies are almost always moving, such that they just want to stretch something, put their hand in their mouth, reach for the breasts, change. These days, 6 months are changing remote control and pressing food. So they want to do something. So you find out that a child who previously was, quite active, is not asleep, is supposedly awake, and yet the child is motionless, or the body becomes stretched and stiff, or the child becomes blue. The lips go from pink to dark, or the hands go from pink to dark. Because essentially during the convulsion, the person isn't breathing. And when that is happening, when that is happening, essentially they're not getting enough oxygen, and manifestation of a lack of oxygen is that dark discoloration of the hands and the feet. So those things are subtle signs that one can look out for. I've seen, some babies that had a convulsion and the child just became unresponsive, and the tap, 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 tap. Of course, that's a real nightmare situation for any mother, that a child that was moving and breathing before suddenly becomes unresponsive. And you can actually see that if you pick a child up, the child won't just flop down in your arms. The child will still have some tone, will want to hold you, will want to flex the legs. Picking up a child that just does that in your arms, that is a really terrifying situation. So possibly the child had a convulsion and it had stopped and the child just became floppy. But yes, those are some of the things that a mother might need to look out for to know that the baby is having a convulsion.
Okay, so I know that you're a pediatrician. Pediatrician means that you cater to babies after they are birthed.
Yes.
However, if you can actually identify a baby with convulsion as young as 0 day or 0
day
second old,
Day one.
is there a way to actually tell when the baby's in the womb that this baby
He's having a seizure.
could, after birth, like there are signs or there are symptoms that a baby could have to say, when this baby comes out, this is likely to happen. Is there a way?
So in the womb, unfortunately, there's really no way of determining if an infant or if a fetus is having a convulsion. But yes, there are things that can tell you that when this child comes out, be very, very, very cautious and observe very closely, because this child might end up having convulsions very early. So usually a difficult labor, a difficult or prolonged labor, fetal distress. A difficult or prolonged labor would mean that the child might not be getting enough oxygen. So
what do you regard as a difficult or prolonged labor?
Labor that is prolonged,
For how long?
So for different, so this is where the obstetricians come in. So usually we give a long allowance to women who are first timers. There's a phase of labor we call the active phase of labor, when the canal that the baby comes out from, and that's not the vagina, that's the cervix, and that starts from 4 centimeters of dilatation, because that exit the neck of the womb begins to dilate gradually until it's 10 centimeters, and then the baby's head just pushes through. You can imagine 10 centimeter head. Some heads are bigger, but the cervix starts to dilate, and so in the active phase of labor, we give between 4 cm and 10 cm. That's 6 cm. We give first time mothers a longer time to give birth, but there is a specific limit, and your obstetrician will be able to tell you that. But once it becomes prolonged, it might mean that either the contractions of the uterus are not very good, or the baby is too large in terms of, so the shoulders might be too large for the baby to actually descend, or there might be something holding the baby back from descending. So, for instance, cord around the neck. Because you find out that if there's a cord around the neck, despite the fact that the uterus is trying to push the baby out, the tightened cord keeps on pulling the baby back. Exactly. So, and sometimes when that happens, you can actually see signs of what we call fetal distress, because each time the uterus contracts and the cord around the neck refuses to let the baby go, that tightening of the cord doesn't allow blood to flow to the baby, and every time that happens, that's some brain compromise. And so anything that will make the child lack oxygen, so for instance, also things like what we call abruptio placenta, such that the placenta, rather than staying nicely on the wall of the womb, gets detached suddenly. All the blood that's supposed to be getting to the baby ends up just seeping into the womb rather than into the baby, and so the baby lacks oxygen, and by the time the baby comes out, the brain has been so damaged that in the first hour of life, you just see convulsions, and these are just a few examples of the myriad of other things that could lead to convulsions in the newborn. So essentially we call that perinatal asphyxia, although these days they call it hypoxic ischemic encephalopathy, whereby so hypoxic, low oxygen, ischemic, reduced blood supply, encephalopathy, brain damage. And so when that happens, the baby comes out and then can have a convulsion.
Okay. 92.3 Inspiration FM is where you're at. It's your baby and you. It's 19 minutes gone past the hour of 11. If you're just tuned in, we say welcome to you. My name is Thelma Ilams. Okiki Akindele and I are on the console. It's more on the console. I'm on the other side of the console. But Dr. Ayo Rana, consultant pediatrician, is who we have in the house today. And we're talking convulsion in children. You can be a part of the show, okay, by coming through with your questions, suggestions, if there are any, fears or concerns, via phone line 0700 923 923 923. On WhatsApp is 0817 313 6193. Let us know, what is it more that you would like to know about convulsion?
Other other sorts of infections like malaria. So malaria, especially cerebral malaria, that's malaria that is quite severe.
Cerebral malaria.
Yes.
We'll come back to that. Let's take this call. Hello, good
Okay.
morning. We lost it again? Oh no.
What's happening with the
Please don't give up
network?
on us. Keep trying. 0700 923 923 923. The WhatsApp platform is available on 0817 313 6193. Cerebral malaria.
Cerebral malaria. So that's malaria. So cerebral malaria is malaria that affects the brain. And
Dr. Raina, please come home now.
sorry, I just moved to Birmingham.
Let's talk about cerebral malaria in Nigeria. I know there's no malaria.
Cerebral malaria is malaria that is so severe that the parasite has actually gotten into the brain, and that can actually lead to convulsions. So when we do see very ill...
Hold on now. We thought that after the bite, they say the parasite is inside the body and then which one? How does it get to the brain? I don't know. You tell us. Let's take this call. Hello, good morning. Okay. If
Hello,
you're
please reduce the volume of your
close
radio.
to your radio, can you walk away from it? If you're driving, can you turn it down?
Hello?
Hello, good morning.
Good
Good
morning,
morning.
ma'am. What's your name, please?
Good morning. I'm Edith.
Edith, did you say?
Yeah,
Edith, where are you calling us from, please?
I'm calling from Shambosedo, somewhere Shambosedo.
Okay, go ahead, Edith.
Hello, can you hear me?
Yes,
Yes,
we
we
can.
can.
Go ahead, please.
I'm Edith. I'm calling from Shambosedo. I want to ask a question.
Yeah?
Go ahead.
Okay, I have a son. He's 17 years old. He was diagnosed cerebral palsy at birth. But what baffles me is he never had seizure until he turned 8. And ever since then, it's been a terrible experience. There's no day he doesn't go without having a seizure. I want to know why now? Why didn't he have it when he was younger? Why when he turned 8?
Why did it delay before manifestation?
Thank you very much, Edith.
Thank you, Edith. Thank you so much. I mean, it's always such a difficult thing to see a child have a convulsion. Now, she said that her son has cerebral palsy, and cerebral palsy essentially is a disorder of movement and posture that results from brain damage when the brain is still developing. So meaning that if anything damages or affects the brain while the brain hasn't reached its full maturity, then it can lead to difficulties with movement and how the person is postured. And other things that can result as a result of cerebral palsy would include seizures, as she has mentioned. And quite frankly, Edith, sometimes seizures will not manifest themselves until the child is much older. Nobody is sure why. I do know people who don't even have cerebral palsy, perfectly normal, fine, okay adults. And the first time they have a seizure is in adulthood. They're in their 20s, they're in their 30s, and the first time they will ever have a seizure or they will diagnose what we call epilepsy for them is when they're in adulthood. So unfortunately, Edith, I can't give you an answer to that question. We are not sure why it delayed for that late. However, she mentioned that she's been finding that the control of the seizures has been very difficult and that the child has been having seizures almost every day. That's what happens when the seizures are the result of a background damage to the brain. The seizures from that background damage tend to be very difficult to control. So
What do you mean by background damage? What caused it?
Yes, that damage that causes cerebral palsy.
Okay.
We're not too sure what it is, but a lot of options are possible. Things like that, asphyxia that I mentioned, jaundice, toxins, infections like meningitis, so those sorts of infections or damages can actually lead to cerebral palsy and very difficult to control seizures. So I suggest that, she needs some kind of brain imaging, such like an MRI or a CT scan of the head to just see what's going on there. So I do suggest she sees a specialist and, sorts that out.
Okay, it's 11:30 actually, so the headline news is now with Esther One. 92.3 Inspiration FM is where you're at, that's the dial, and the show is Your Baby and You. We've been talking about convulsions in children, what convulsion actually is, what could trigger it, that's where we were, some of the signs and symptoms. Did you know that a child as young as one day, because I can't just find myself saying 0 day old. 1 day old, that's just a day old, could actually have a seizure. I find that very, very heartbreaking. But I don't know. It's just there's just so much going on. And then I saw a page that Kiki had opened on the internet, And I was just wondering, what's the difference between all of this? Epilepsy, convulsion, cerebral palsy. There seems to be, other conditions out there that are sort of similar. But before we get into that, we were at cerebral malaria, I think.
Cerebral malaria.
Yes, where you said the parasite can actually, when the parasite gets to the brain, how does
so,
that happen?
So the malaria parasite, you see, when village people were sitting down to concoct things, the malaria parasite was the first thing that they thought about. They said, this thing, how are we going to make sure that it punishes people very well? Because people are still dying from malaria, weirdly, you don't just people are still dying from malaria. It's crazy. So the malaria parasite lives essentially in lots of places in the body. So essentially, it can go after getting into your bloodstream. It first of all goes to the liver, builds Banana Island, builds the estate, and then it now leaves the liver and then moves around. And as long as it's in your bloodstream, it really can get anywhere. But the thing about the blood vessels of the brain is that the blood vessels of the brain they are small, and then they are really curved, so they are really tortuous, and so it's very easy for the malaria parasite or for the red blood cells that have been infected by the malaria parasite to just get to the blood vessels there in the brain, and then they will cause what we call clots to form. So essentially the blood will not be fluid anymore. It will make the blood turn solid more or less, and then block those vessels. Those vessels will burst, and then they will bleed, and then the individual will have a convulsion and become unconscious. So that essentially is what happens. So it has a special predilection for the blood vessels of the brain because they are short, they are really curved, and they are tiny in terms of how wide they are. So they just doesn't let the parasites through. So that's essentially what happens. And of course, people that are at risk of developing cerebral malaria are children who are less than 5 years, individuals who have been abroad, who have lived in an area that does not have malaria, that is non-endemic to malaria for more than 10 years. They're susceptible. Pregnant women are also susceptible. People that have sickle cell anemia are also susceptible. So these are, the susceptible groups. So always you look at prophylaxis such that they are taken. I was referring to cerebral malaria. So the prophylaxis is for cerebral, for malaria. For those individuals for certain individuals who might be predisposed to developing severe forms of malaria, we give them prophylaxis to prevent them from getting malaria at all, like sickle cell anemia patients.
Okay, so I have a friend who just keeps ringing that thing like it's biscuits, and I'm just wondering, prophylaxis? So I think it's supposed to be like a prevention for COVID and stuff like that. So hearing you mention it now, I'm just wondering, where do you prophylaxis? I don't want to hear that name again.
That word again.
Prophylactic? No, it doesn't happen that way. Okay, so triggers is what we're still talking about. What other things?
Yes.
Could
So
actually
we talked about poisoning yesterday, last week, and then so consumption of certain things like excessive amounts of alcohol, certain drugs can actually trigger convulsions in children. So you want to keep drugs out of reach of children. Then
certain drugs. What drugs might these be?
Yes. So weirdly enough, anticonvulsants can actually trigger convulsions. Certain types of antidepressants can trigger convulsions, and so I can't tell you the specific names, but what I say is that keep all drugs out of reach of children. That's the safest thing. Then unfortunately, brain cancer of the central nervous system can cause convulsions. So for a child who has been free of convulsions for a long time and then suddenly begins to have a convulsion with certain other symptoms, we always go on red alert and say, could this be a brain tumor, a tumor growing in the brain, which can lead to convulsions. Also, so I've mentioned infections, things like cerebral malaria, meningitis, certain viral infections of the brain. We call them viral encephalitis. So those can actually cause convulsions as well. And convulsions can result from things like diarrhea, actually. So if a child because when a child is having diarrhea and is shitting water shit, is that allowed on morning TV, on morning radio? water shit. That water shit is not just water that's coming out. It comes out with a lot of electrolytes, a lot of sodium. Now, what these things are, sodium and electrolytes, they essentially are the things that help our bodies to function. And it's like salt in our bodies. And when you lose salt, there's a tendency for the individual to have convulsions because there's some sort of imbalance in the system. And so if you see a child that's having diarrhea that has convulsions, we get really worried because it means that the sodium level in their body is significantly low, which is why we always say if a child is having diarrhea, please get ORS and start using as a sort of first aid before you come to the hospital, so that the child doesn't keep losing water and sodium and those other important electrolytes that can lead to convulsions. Then epilepsy. So even though epilepsy isn't, so you're saying a lot of epilepsy is, which we will just address that now.
Go ahead, please.
Epilepsy is a tendency for an individual to have repeated convulsions. So a convulsion, essentially, we already said what a convulsion is, but if a person has a tendency to have repeated convulsions, then
How
that is
often
epilepsy.
is repeated? Because cerebral palsy, you had to call it. He
Yes,
said
yes,
his son suffers every day.
So he has epilepsy as well. So once you have, as a matter of fact, you diagnose epilepsy, once you have more than one febrile, one seizure, one convulsion without a fever, then you are diagnosed as having epilepsy. So if a person, for instance, today has a convulsion, doesn't have a fever, was just walking on the road and then just started having convulsion, and then 2 years later he has another one walking on the road and has another convulsion without any fever, the person is said to have epilepsy. So once you are able to have more than one, some specialists say 2 or more, but once you have more than one convulsion without a fever, you are diagnosed as having epilepsy, and they will have to run certain tests to find out what type of epilepsy that individual has. So it doesn't matter how frequently or how infrequently it happens. Even though, of course, the less frequently it happens, the better it is, for everyone around. Because children that have epilepsy, because there's a tendency for them to have a convulsion very unannounced, you don't want them to do things like swim. As a matter of fact, you don't want them to go into the pool. Some people will say they can go into the pool, but with close supervision. That supervision has to be very close. It must be in a very shallow pool. But think about them, deep, on the deep end, diving down the water, and then they just have a convulsion. What's happened? What is the coast and the lifeguard, doesn't realize that that's what's going on. So you really do want them to avoid certain things. You don't want them to be in the kitchen in front of a naked flame unsupervised, because if they had a convulsion carrying something hot or in front of the flame, you can think of all the damage that could be done as a result of that convulsion occurring there in that situation. So epilepsy essentially is a tendency for an individual to have repeated convulsions.
Okay. It's still your baby and you. We're still talking convulsions in children. We'll be right back after this time out. Uncle Rena. So I'm going to ask you for treatment. Can we just have like a little empathy in our tone, so we don't really sound like... So I have a thing when I ask you what treatment, can it be treated? I'm a mother. I can't imagine if my child had convulsion. It would just not be funny. So let's just have some empathy in our tone. Thank you. Okay, let's go back. And indeed, we are back. Can we go on? Okay, we'll be back. We'll be back. Let's look at treatment. Has convulsion got a treatment? Can it be treated?
Yes. Convulsions can be treated. Usually what we do is that at the time the individual is having a convulsion, if it is at home, please, what is the first rule?
Don't panic.
Okay.
Thank you.
Sorry, I'm not giving him.
Why not? You're not giving him?
Let's move on.
Beef.
Okay.
So, don't panic, because a convulsion at home is a very alarming situation. And when a convulsion starts to happen at home, that is when people want to look for a spoon to put in the mouth of the baby to prevent them from swallowing the tongue or biting the tongue. Or that's when they want to stick the foot into a fire to make sure that the organ that is causing the convulsion is extradited. That's when they call for the urine of an old woman, or for crude oil, or for manue K, which is, python oil. That's when a lot of things just come out of nowhere. Things that you didn't realize people used to store in their homes. Cow's urine comes out, and those things are very counterproductive. Please don't do that. Usually most convulsions will stop by themselves within 5 minutes of starting. So I know a lot of people don't have the presence of mind to time. So by the time the convulsion starts, that's not the time you want to be timing how long the convulsion. In your mind, that convulsion has lasted for 2 hours as far as you are concerned, and you are really panicked. So just losing any tight clothes that the child might have on, lie the child on his left side, Make sure that there isn't any tight clothing on the child. Don't pour water on the face. Don't put anything in the mouth, because at that point in time, the ability of the child to swallow safely is gone, because they're not able to coordinate swallowing, and so putting anything into their mouth might lead to them getting it into their lungs. That's called aspiration. So you really don't want to do any of that. Please, I guess this is one of the rules that we don't say often enough. When you're moving into a new place, please look for the good hospital near you. Don't always look for, I know some of us have managed care and HMOs that are paying from our work out of our salaries, but sometimes for emergencies it's good for you to find the closest decent hospital to you, register there, so that if you need an emergency situation, you can just quickly get there and they sort the emergency situation out. It's not that at that time, 12 midnight, you now start trying to get to the hospital that you gave birth in. No, or when they have a history of the child. An emergency requires urgent care, and so please make sure that you move the child as safely as possible. Don't and try and support the head and neck of the child. Don't jangle the child around, because in jangling the child around and trying to exit the door, you might bang the head on the door. That might compound the issues. So please go to the nearest hospital. They will administer certain drugs to stop the convulsion at that point in time. However, the greater need is for us to determine what is causing the convulsion and then treat that cause. Whether it is cerebral malaria, we'll run a test to see if there's malaria parasites. Whether it's electrolyte imbalance from diarrhea, low sodium, we will, get a history of, we will ask you questions about what has been happening in the last few days. So if the child has fever, it gives us an idea of what might be causing the convulsion. If it was a sudden convulsion, we'll ask about things like when last did the infant, or when last did the child eat, because it could be low blood sugar. But sometimes if the child hasn't eaten for long, low blood sugar might actually be the cause, and all you need to do is just give a little glucose and the child will get better. So we need to determine what is causing the convulsion and then treat that. For epilepsy, we give certain drugs that the individual is going to be on for a long time. As a matter of fact, we give them those drugs until they are seizure-free or convulsion-free for at least 2 years, and then we begin to reduce the dose of the drugs until we can stop. So essentially, sometimes we are successful in treating the convulsions, sometimes we are not. Fortunately, I have seen cases where we threw everything we could at these convulsions and they really didn't just stop. Changed drugs, added drugs on, increased the dose to the maximum dose. So some seizures like that are very difficult to control, and in such situations we have to escalate to the super specialist, the pediatric neurologists, or those that are really sub-specialized in that particular area.
Do children ever overgrow convulsion?
Yeah, some children do ever outgrow convulsions. Yeah, some of them, will I call it outgrow? I wouldn't really say the word is outgrow, but the seizures just go away. The seizures just go away. They just
the way
stop.
they came.
Yes, the same way they came. They just stop for no particular reason. Sometimes, while they're on the drugs, the seizures do stop. For some, they just have one seizure and that's it, and they never have another for the rest of their lives.
Okay, what else might you want to put out there before we go?
So it's just to say that convulsions can be very alarming, parents. Everyone, yes, convulsions can be very alarming, but please do not panic when they happen, because panic is the easiest way of allowing yourself to convulse.
All right. And if Lagos wanted to reach you any further, how can they do that? Is there a social media platform?
You can reach me on Instagram. My Instagram handle is at the Noisy Naija Paediatrician. It's a mouthful, but once you put THENOISY, usually I'm the one that comes up because I'm the only noisy person in the area. Then on Twitter, it's at the Noisy Naija P1. I think I'm going to have to change that one. The Noisy Naija P1. And send me, a DM, and I will get to you.
All right. And you can follow us on Instagram. Mine is at Thelma Ilms. My name is Thelma Ilms.
And my name is Okikioduwa Akindele. You can follow me on all social media platforms at Okiki Akindele. You can follow the station at IFM 92.3 on Instagram and at IFM 923 on Twitter.
All right, there you have it. Thank you so much, Dr. Ayarana. We appreciate you.
Thank you.
Thank you to all listeners for being a part of the show. Thank you, Edith, and I really pray for God's strength, grace, and guidance upon you. And what seemed like a miracle, where Dr. Rana actually said, it left the same way it came. I declare that in the life of your child. In Jesus' name.
Amen.
We got to step aside. We'll take a break now, Lagos. At the top of the hour, the world news comes up.